take care of kids with congenital heart disease. And as part of that, we often want to look at their hearts and valves. And with that, we want to see both the tissue and myocardium, including cardiac valves, as well as the flow moving through the heart. And that can be hard to do with echocardiograms. They sometimes you don't have the greatest views into the heart. In CT scan, you can see the tissue, but not the flow. And so we really wanted to be able to develop this from MRI, specifically 40 flow MRI, where you have both the volume information showing the heart and the valves, but also the blood flow. And so that information was there, but nobody had put together the ability to visualize both at the same time in a rapid or near instant manner. And so we worked together in teams consisting of both clinicians and engineers to use a technique called volume rendering to visualize both. We are visualizing data that has existed in a new way. That said, many of these image acquisitions are novel and allowing this visualization to be more impactful. So I think that further development of both the acquisitions and refinement of those acquisitions, and in concert with further development of visualization methods, will um, realize the true potential of this technique. We're just scratching the surface. Yeah, no, it's a great point. So I see photon counting CT as a important um, uh, technology, particularly in children where we want to use the minimum amount of radiation possible. 4D CT can give very high resolution studies with less radiation. And so that is an important technology. But CT cannot show flow. So it can show the myocardium moving, the valves, but you can't see flow through the valves, flow through the heart, and you can't calculate things like regurgitant fraction, how much blood is going backwards through a valve. Uh, in contrast, MRI allows you to do all of those things with no radiation. And so it used to be that CT had much higher spatial resolution than MRI, but those gaps are being closed a little bit. I think that photon counting CT just upped the bar again from regular CT. But there's a nice friendly competition between the CT physicians and the MRI physicians, where both are trying to um, make more relevant, make the images more relevant to interventional planning and surgical planning in our population. So I see them as complementary techniques, but somewhat competitive, but also complementary. So once you have developed presets for standard acquisitions, the rendering is nearly instant. So you can get something that's 90 or 95% of the way there in about 5 to 10 seconds. If you want to fine tune that last 5 or 10% in skilled hands, that can take a couple of minutes. But I think that with further standardization of both the acquisitions and visualization techniques, it will get easier. And I think we really drew inspiration from 3D echocardiography in this regard. So there, we were trying to create images using MRI that mirror those we see in echo, but you can't always get great echocardiograms. Sometimes the sonographic windows aren't very good, or sometimes the angle at which you're looking at the flow is not optimal. And MRI isn't really constrained by those um, challenges. So Notably, almost all visualization of 3D echocardiograms is volume rendering, both the flow and the tissue movement. And so we tried to bring that paradigm and that mentality to MRI. And so it's instant, it's fast, and we think that with further refinement of both the acquisitions and the visualization, that it could become a very commonly deployed technology. So very good question. We, like many other centers, pediatric centers across the country, are increasingly using 3D modeling to inform interventional and surgical planning. It's becoming standard of care. The exact way that you create models varies. Sometimes you make segmentations as you do to inform 3D printing, and other times we can volume render and generate a visualization that allows us to do that planning faster than you can do a segmentation. Uh, this is evolving. Machine learning has changed the rate at which we can do segmentation, but it still is challenging for 4D, where you have multiple frames to be reconstructed. And that's where volume rendering can be done fast and instantly. Segmentation still has a place. Let's say you want to do simulations, not just visualizations, but simulations based on an initial anatomy as well as several uh, variants created by virtual surgery. For that, you would need to have a segmentation because you need real boundaries and not just a visualization technique. And only segmentation can provide that. So they're complementary technologies, but for fast visualization, especially of moving images, volume rendering um, is promising. Again, already used for echo. We're just kind of porting it to MRI using both these emerging acquisitions as well as this visualization technique. In terms of validation, we want to make sure that it's faithfully reproducing um, uh, what we consider gold standard. For example, echocardiography, both from 2D or 3D. We demonstrated initial findings and a few examples that show that the regurgitant jet that we see from echo is in exactly the same spot that we're seeing it by volume rendering from MRI, but we've only provided a few examples. So this needs to be expanded. We need to generate sequences that are MRI sequences that are specifically geared towards this type of imaging. And now that it exists, I think people will be able to refine with that trajectory in mind. I think another cool thing, this is all built on open source software. We implemented it at the level of the Insight Toolkit ITK. So all the framework is there. It's bundled into 3D Slicer and Slicer Heart. And in the next 6 months, it should be we hope implemented in a easy to use module rather than just code if you know what's under the hood. So keep an eye out for that by the end of the year. And we're excited about sharing this with other centers.